What is subarachnoid hemorrhage and stroke surgical clipping? Have you ever wondered what happens when someone suffers a subarachnoid hemorrhage? This serious condition is a type of stroke that occurs when there is bleeding in the space between the brain and its protective tissues. This space is known as the subarachnoid space. The bleeding often results from a ruptured aneurysm, which is a weakened area in an artery wall. Less frequently, it can be caused by an arteriovenous malformation, which is an abnormal tangle of blood vessels. When bleeding occurs, it can lead to a rapid increase in pressure around the brain. This pressure can cause severe brain damage or even death if not treated quickly. The most common symptom of a subarachnoid hemorrhage is an extremely severe headache, often described as the worst headache of one's life. Other symptoms may include a stiff neck, nausea, vomiting, sensitivity to light, blurred or double vision, and neurological deficits like weakness or slurred speech. This condition is a medical emergency, and immediate evaluation in a hospital is crucial. A computed tomography scan is typically used to confirm the presence of bleeding. Now, let's talk about stroke surgical clipping. This is a neurosurgical procedure designed to treat a ruptured or unruptured brain aneurysm that could lead to a subarachnoid hemorrhage. The primary goal of surgical clipping is to prevent further bleeding by sealing off the aneurysm from normal blood circulation. During the procedure, a neurosurgeon creates a small opening in the skull, known as a craniotomy, to access the brain. Once the aneurysm is located, a tiny metal clip is placed across the neck of the aneurysm. This clip effectively stops blood flow into the aneurysm, isolating it from the artery. By doing this, the risk of the aneurysm rupturing again is significantly reduced. Surgical clipping is one of the main treatments for subarachnoid hemorrhage caused by a ruptured aneurysm. Another option is endovascular coiling, which is a less invasive technique. The choice between clipping and coiling depends on various factors, including the size and location of the aneurysm, the patient's overall health, and the risk of complications. While surgical clipping can provide a permanent closure of the aneurysm, it does involve open brain surgery, which carries risks such as infection, stroke, or neurological deficits. After the procedure, care focuses on managing potential complications like vasospasm, which is a spasm of the arteries that can lead to brain ischemia, and hydrocephalus, which is a buildup of fluid in the brain. In summary, a subarachnoid hemorrhage is a life-threatening stroke caused by bleeding on the brain's surface, most often due to a ruptured aneurysm. Surgical clipping is a critical intervention to treat these aneurysms by physically closing them off to prevent further bleeding. This procedure is a cornerstone of acute stroke treatment in specialized centers. Prompt diagnosis and treatment are essential to improve outcomes and reduce the risk of permanent brain injury. Always consult healthcare professionals for personalized medical advice and treatment options.